Hello once again. We are now going to speak to you about another disorder which is called Alzheimer's, which is a degeneration of the brain. Alzheimer's is a condition where your memory is affected, especially the recent memory, meaning what you did an hour ago, the person you spoke to this morning, or someone that you saw yesterday, you may not remember. It begins very insidiously and it gradually increases. It affects people who are a little from the older age group. Above the age of 65, it is estimated that about 10% of us will get Alzheimer's. And over the age of 80, about 50% of us will get Alzheimer's. Up to now, no one has been able to fathom what exactly causes Alzheimer's. But we do know that there is degeneration of certain areas of the brain which are very uniquely positioned for the memory, language, and therefore language is also affected, and executive functioning. By that we mean the ability to do complex tasks like going to a bank and dealing with the finances, etc. Now, as this gradually declines, the patient will ultimately go into a state where he'll be like a child or even an infant. Unfortunately, till today, there is no known medication which can halt this or reverse it. The medications available till today can only at best postpone it by 6 to 8 months. So you get about 6 months to 8 months to a year when you have a slight improvement, and then once again the patient deteriorates. Famous people who come to mind: the President Ronald Reagan, Prime Minister of UK, Margaret Thatcher. They ultimately reached a stage where they didn't even recognize their own spouses. They didn't know who they were. So this is how it can go. Now, what has not been looked at is something which is very interesting, that it is known that many years before these patients get Alzheimer's or they manifest as Alzheimer's, they already have certain areas of the brain, which are the same areas I spoke about, where glucose is not being utilized. There's a lot of glucose in the blood, but it is not being utilized because there is insulin resistance in these areas of the brain. In fact, some people have labeled Alzheimer's as diabetes 3, as the third type of diabetes. So, very simple thing. If you can't use glucose, you give an alternative fuel. Like in your car, if you can't use CNG, you use petrol. You can switch over. So what do? You know that glucose comes from the carbohydrate we eat. It gets converted in the liver. But we also know that animals and man, when they do not get carbohydrate, as when they fast or when they don't get food for a long time, they can use the body fat that they have stored. The body fat goes into the liver and is converted into what is called as ketones. And ketones can feed these brains. Now, it is also being shown by PET scans that glucose cannot be utilized by these people, but their ketone utilization is optimal. And so therefore what we give is increase the fat, lower the carbohydrate, a type of ketogenic diet. We've talked earlier about the ketogenic diet. Maybe you don't have to be so strict because you really don't want the glucose to be very low. That doesn't matter. What you do want is for ketones to be available. We have put some patients on this and they have done well. Let me give you just one example. A 75-year-old man who has a memory loss since the last 4 to 5 years. When he used to come to me from Thana to Mahim, he never knew where he had come. He didn't realize the roads. And when he finished with me, he would tell his daughter-in-law, "Oh, we can go home within 5-10 minutes. It's just across, right? It's not very far away." And we know that it takes 40-45 minutes at least. Within 6 months of putting him on a higher fat diet, he not only could recognize and realize where he is going, he could tell the driver where he should turn. Number 2, he started interacting with others. With his family members, when he used to sit around and they used to talk, and he would interact and give his opinion on it. He never did this for almost 2 years. He started making jokes. Now, this was something he had done 4 to 5 years ago. For the last 5 years, he used to sit in one place, he used to not interact with anyone. And for the first time, we spoke to him every time, I used to talk to the daughter-in-law, oh, his Alzheimer's is not doing well. You know what Alzheimer's is. For the first time, after so many sessions with him, he asked me, doctor, I have Alzheimer's? And I said, yeah, you have Alzheimer's and you're improving. He said, yeah, I thought I may have it. All these years I didn't realize, but now that you're talking about Alzheimer's, now I have understood what I have. So not only did he get back his memory, not only could he take new facts, and he could interact with others. So this has really proved to them a boon. So a simple diet can improve a horrifying progressive disorder like Alzheimer's. So I would request all of you, you're going to get old one day. You may have parents who are old. If they'll start losing memory, don't just say, oh, it's because he's old. No, he or she doesn't lose memory just because they're old. It could well be Alzheimer's. And today we have something that can help in Alzheimer's, which can halt Alzheimer's and maybe reverse Alzheimer's to a large extent. Thank you.